Now, let's look at some commonly asked questions pertaining to total hip replacement. When can I stop using the walker, crutches, or cane? Of course, this varies. It depends on your type of replacement and your surgeon's recommendations for you. If you're unsure, wait to talk to your doctor. When you use a cane, it should always be in your opposite hand from your surgery side. Can I refill my pain medications? Normally, we give you a refill for approximately 4 weeks. However, most patients discontinue these after a few weeks. Remember that while you're on narcotic pain medications, you should not drive or operate any machinery. Will I become addicted to these narcotics? It's unlikely given the short-term use, but you should also be aware of the side effects, which include nausea, constipation, and itching. Use these medications only as needed. How does all of this affect my sleep? Sleep difficulties are normal. That's because of the effects of the surgery on your body, the pain from surgery, and the medications you're taking. You should return to a normal sleep cycle a few weeks after surgery. What about my appetite? A loss of appetite is a normal effect of surgery and the medications you're taking. What about driving? Check with your doctor, but usually you can resume driving after 6 weeks. This also applies even if you've had your left or non-driving leg operated on. In addition, the narcotic pain medications will also impair your ability to drive safely. Will there be any swelling? It's normal to have some swelling in the leg you've had surgery on. The swelling slows return of the fluid from the vein in your leg. You can relieve the swelling by elevating your leg on pillows several times a day. If you develop painful swelling in your calf or thigh, this could be a deep vein thrombosis. This, however, is rare while you're on blood thinners. You can also help relieve the swelling by wrapping the leg with an ACE bandage or a compression stocking. If you're unsure what to do, contact your doctor. When is swelling in my legs not normal? If you develop swelling in both legs, you may be retaining fluid. If this doesn't improve with elevation, or you develop pain in your calf, contact your doctor. Can I lay on my side? You can do this as soon as you feel comfortable, but make sure you maintain the hip dislocation precautions you learned in the hospital and use a pillow between your legs at least until your 6-week appointment. Then ask if you need to continue using the pillow. You don't need to use a pillow between your legs when sleeping on your back. How long will I have to go to physical therapy? Normally, you'll not need formal physical therapy after leaving the hospital, but you'll need to continue the exercises you've learned twice a day until your 6-week appointment. When can I resume sexual intercourse? As soon as you feel you can do so safely after 6 weeks, but make sure you follow the hip dislocation precautions. How long do I need to follow those precautions? For the rest of your life, especially during the first 3 months after surgery, since scar tissue forms around your hip. What are the signs of infection I should watch for? Fever above 101 degrees. Cloudy drainage from your incision. Considerable increase in pain with movement of your hip. If any of these occur, call your physician. Do I need to continue on the blood thinner when I go home? Yes, you'll remain on a blood thinner for 3 to 4 weeks after you go home. Your doctor may decide to check with a test called a ProTime. If your surgeon prescribes Coumadin or warfarin, you'll need a blood test 2 times per week to monitor how it's working. When can I shower or bathe? You normally can shower within 3 days of surgery. Gently pat dry the incision with a clean towel. But do not take a bath. Use a hot tub or swim in a pool until the incision is completely healed, which normally takes 3 to 4 weeks. Ask your physician before attempting these. How do I care for my incision? Keep it clean, dry, and open to the air. Don't use salves or ointments unless approved by your physician. You may have paper steri strips covering the incision stuck with a special skin adhesive. If you have these strips, they'll usually fall off on their own in a few weeks. Can I ride a bike? You can do that whenever you feel you can safely do so while following total hip dislocation precautions. Can I travel? You should wait at least 6 weeks before going long distances unless you ask your doctor for clearance. When you do travel, stop frequently, every hour or so, to prevent problems such as a blood clot. Can I golf? Yes, as soon as you can safely get around the course without falling or getting hurt. But because of uneven terrain at most golf courses, you may want to wait at least 6 weeks. What about going to the dentist? Try to have any dental work before your surgery. Otherwise, wait 3 months unless it's an urgent need such as an abscessed tooth. At that time, you'll get instructions about taking antibiotics before dental work. Will my new metal hip set off the alarm at the airport? That depends on the sensitivity of the machine. It may. That's why you'll get a laminated card stating you have an orthopedic implant. Show this to the security officers. If you forget your card, allow the officers to wave the security wand over your hip. How much physical activity can I do after surgery? Of course, your joint replacement will last longer when curtailing extra stress. You should never run, jump, or do heavy lifting. Permanent work restrictions include the following: no repetitive lifting more than 40 pounds, no bending, kneeling, and climbing. However, you can do sports such as golf, doubles tennis, and cross-country diagonal skiing. Avoid downhill skiing, running, basketball, softball, and singles tennis. Always discuss your limitations with your surgeon. His directions will be for your particular situation and needs. Is it normal to feel weak after surgery? You may feel tired and weak after surgery. This may be caused by blood loss during surgery or from some of the medications you're taking. If you're concerned or you develop shortness of breath, dizziness, or chest discomfort, contact your doctor. How much help will I need after surgery? You'll need help until you can get around your home safely with your walker or crutches, and in and out of bed alone within your total hip replacement precautions. You'll need help getting dressed because you shouldn't bend more than 90 degrees at the hip. Some patients require a temporary stay in a nursing home. It's your responsibility to investigate the facilities near your home or make arrangements for care from your family or friends following hospital discharge. The hospital discharge planner will meet with you after surgery to finalize these plans. If my leg was lengthened to help prevent dislocation, what can I do? Once you can put all your weight on your surgery leg, your surgeon will determine the amount of difference in your leg lengths. Depending on the difference, you will need a lift on either the inside or outside of your shoe. At Marshfield Clinic, we want to make your procedure as comfortable for you as possible. Thank you for choosing to have this procedure at Marshfield Clinic. If you have any questions at any time, please don't hesitate to call us.